Oswafo share apomode ensem so ye kwabna minta Akandoh no de atudwa ese aban e de hyehye gu akwanso ye ba no apomode hye ene emunimde ne ba bi krompo ho ama ne bonyina ye de egu a aban no toto enuma dendede ani enche bia no womode ho ama ne ebetudwa ahyase de ye adwuma.
Digital innovation has become the driving force behind our transformation. We are building a centralized national health intelligence database that will allow our real-time data analytics, greater transparency, and truly evidence-based decision-making at every level of the health system. To support this, we are developing a national middleware layer onto which all digital health platforms will be integrated. This ensures interoperability, national ownership of all data generated, and the ability to use that data to improve the lives of our people. This digital shift is strengthening governance, improving operational efficiency, and making our health system more responsive to the needs of our citizens. It is enabling us to track disease faster, allocate resources more efficiently, and hold ourselves accountable to higher standards of performance and transparency. Digital transformation is not an accessory to our reforms. It is the backbone of a modern sovereignty and people-centered health.